Yeah, Danny Nalgido, the Isonostagi, Jonathan Nez, Navajo Nation President. The Monat Leho E Qua Hanet Hitchakundel, the Kusinskagi na States the COVID-19, Ban Hanegido, Kodonaka Shindo, Zel Indan Lingi, Alka Natchagido, Yikidades, Igi Ekon, Banda Huilne, Aro Zedo Bikijana Neshigi E. Da halon do kodoni jo but deni kid khada atse di ade denades kid de shladin ha hot zogo ebinina ekodo ashwanda da di no sai aita alla do na kin khada atse da do ne akon de khado di go ye ol kilo da de di zeb kijna nishigi so kodoshi eight so the zenbe ade neto list ade da isunov sagi Jidin gariod editje kwa inan ka in lagi ba ke nitsen aro kwa na khandal na shigido ba watso dilzen kiden ish di yod edo kon azze azze bikje na bahagido bikje na neshigi kodo na kha adalia don hije kodalia ba ke nitsen shidi yod e aro kwa ein kha nik ein na kha chindo kiden I doles aro zel endan lenigi do kon na khandal nishigi edo kodo batso dilzen tlada batso dilzen also kodo nche kodel ne dole do kodel ya dole shiken kodo shidi yot edo kon hik edan lenigi bkiden e dole. We just pray today as we always open up in our town hall meeting for our people that are out there on the front lines and those that are dealing with this pandemic or this virus, those that are long haulers, those that have long-term health issues from it, those of our family members that have lost loved ones because of COVID-19. We just lift them up to you for protection and comfort during this time. We just over oversee the nation's healthcare system here in a positive direction. And we just pray for those that are helping us in various areas. We pray for Dr. Cameron Webb here, who's going to be speaking to us. Lord, just continue to protect him, protect his family, protect his team as well, because we're all doing it for Five Finger Beans. We just give this time to you. We pray this all in the name of Jesus Christ. Amen. So, as always, we open up with a prayer. We do have a special guest today, Dr. Cameron Webb. He's the senior advisor, the White House COVID-19 response team, the executive office of the president, and the president here in Washington, D.C., President Joe Biden. I am in Washington, D.C. We just are in the midst of the National Indian Health Board quarterly meeting, and we are getting really up-to-date information what's going on throughout the country. So adenta isunol tsagi kodo e ya nakhandal nishki tsleday dan linigi e kodo ni ha da hat sich dole Dr. Cameron Webb e kuje Joe Biden e yanal nishalaje kuje kintlagay has aje e nihinat anin linigi e kodo di nal khagi di kosan tsagi na states at Ajme nanish isle. Aro Dr. Jill Jim do aje do bikido ni bikedi ni aje do thatasita ishi kodo yishil dal nishigi kodo ni hatsi dole. So, for us here on the Navajo Nation, we are seeing a slight increase in cases. One of the messages that we continue to forward over to our Navajo people is don't let your guard down. This is the third year, yes, and usually during the holiday season, you see that spike. We just got done with Thanksgiving. We're going into Christmas, New Year's celebration. Let's stay the course. And of course, our vaccinations are very important to get. Some of you are saying, well, I already got my first, I got my second. If you were up to date on your vaccination for COVID-19, we're on our fourth shot now. So it is very, very important that you get your vaccination and protect not just yourself, but our people, All across the country, people are looking to Indian country, looking at the Navajo Nation, saying, how did you guys do it? You were able to turn it around. Let's continue to keep, that going into 2023. And I always say it's because we listened to our leaders, we listened to our healthcare professionals, we were able to turn it out. It wasn't about us as an individual. It wasn't about our freedoms. It was about protecting our families, our community, and our Navajo Nation. Let's continue to keep looking at toward helping each other throughout this public health emergency. So what I'm going to do is I'm going to switch out seats here with Dr. Webb, and he's going to introduce himself. Let's welcome Dr. Cameron Webb, Senior Advisor for the White House COVID-19 Response Team. Dr. Webb?
Hello, everyone. First off, let me say it's an honor to meet you in real life, President Nez. We had the chance to work together some very early on when I joined the administration on an emergency declaration. And what became apparent immediately was just the strength of leadership that you all have in Navajo Nation, from President Nez to Dr. Jill Jim, who I've worked with a fair bit. There's just no shortage of strong, thoughtful, capable leaders advocating for the needs and concerns of Navajo Nation here in Washington, D.C. And so I want to start off by saying, you've done an amazing job. You've done amazing work in getting people vaccinated in particular. And you heard the statistic earlier, and I mentioned it in the NIHB meeting, that over 90% of elders in Navajo Nation have received the vaccination. That's a big deal. And I don't want to just talk about vaccines for the sake of vaccines. We're talking about saving lives. And if you look at the early days of the pandemic, we saw that in tribal communities, you saw 4 times the number of deaths from COVID that you saw among non-Hispanic white communities across the United States. And what that tells me is that there was significant risk of harm that this virus was causing in communities like yours. But through a lot of the hard work in this vaccination effort, a lot of people got vaccinated, and that made a big difference. And we see much lower rates of death from COVID these days, much lower rates of hospitalizations, even fewer cases. And for some, that might lead you to feel like this is over. It might lead you to feel like we've gotten past all of this. But in fact, that's not the case. What is the case is that we used the tools that are necessary to save the lives of our family, of our community members, of the people that we love. And we need to continue to use those tools. And President has talked about the new vaccines. And I want to put that in a little bit broader context here. The original vaccines were very important and very helpful in reducing the risk of death from COVID-19. But if you got vaccinated in December of 2020 or January or February or even March of 2021, it's been more than a year and a half since you had those shots. And in that time, what your body's immune system has done is it's become less effective at having the protection that you originally got from those vaccines. In that time, you have become more vulnerable to what COVID can do, whether it's you or your family members. And so that's why it's so important that people get those updated vaccines, because what it does is it gives you a lot more protection for the version of COVID that's circulating right now. We don't want to let our guard down. We don't want to take our eye off the ball. We want to make sure that we are continuing to use these tools, the vaccines, the tests that people have been using at home to know whether or not they have COVID, the treatments, whether it was the monoclonal antibody treatments or now the newer pills that people can take to prevent them from being hospitalized or dying from COVID. President Biden here in Washington says all the time, we can prevent almost every death from COVID-19 with the tools we have today. But people need to make sure that they're vaccinated. They need to make sure that they're testing if they have symptoms or if they have an exposure. And they need to make sure they're getting treated if they have COVID-19 and have risk for severe disease. You do those things, the risk of dying from COVID is significantly lower. And we need to keep that in mind. And so I just want to say, it was important to me to stop in And just to thank you all for the incredible work. It's not an accident that the number of people got vaccinated in Navajo Nation that did. That was an incredible amount of hard work. That was a lot of people leaning into their loved ones, encouraging them to protect themselves, to protect each other. And that made a huge difference. But the job's not done. And really do encourage you to continue to do this work. We want to be a partner to President Nez, to Navajo Nation, as you continue to do this work. It's critical, it's important, and we're certainly in this together. So with that, President Nez, thank you for having me today, and you all have a great day.
Right, yeah, Dr. Cameron Webb, Washington, the A, Credo, the Codon Ziggy, Niki Laja Dasdagi, President Joe Biden, Dabidi Nia, Yanad Nashti, Kuja, Nash Nigi, Nikis Yahish Nigi, to Kosenskagi, Nas, the Aids at the Delka. Don le, the Nebiki Yapaka, or the Adahon, Nishiki, Edon Delka. A conde, do a con Dahon Nista ya. Skonle toin nande do Diego de na deskit na das was China de Edo na de na deskit do Edo koda ya ansada kes halet ya kodo bikije del nesto lesti ya hisnigi hat no jo kodo ya holne nihe kodo da isno tsagi nihe na khasla di nihe mas chodal Nihilla do di jostoit inin del sergib nihilla bedaltla. Ado di ze do bikijit na anishigi do naha da atse da hatne. So dik ad alla da zanachi tlashinha da atse. Ako ze iki ya do yego na nishta. Ebni na hastran de zido. I da la naha na da tse da no da kudo zel in ya dalti. Nihi joba deni kid bini na da shnigi at yego de des kidle tonan de nana jo hot in his ya ishni. Tra na khayan da bansada keshik eno lini. Nihi kad nahasala nihbeda hazan. Mask chudashe, hand sanitizers do chudashe. Aro ye la asla handatleta. Asla handatle ho asho nkhatanes kego do anda khed tadi no yasan hije kondel ishik enaslin. Aro kwado zegi vaccination do edo nkhada atseta di no di kanana khagi Nleish ladin haut so that is ingi yansda kiso de nad dot kisoda bini na hadainotni do kodon khaschindo ni keni nabje yadaltje so she ada be jini khida nind do she hot hadainotne hina nish andi adas kodon hije haut zigi zel in le ya iltra doctor Kodoni had see do Kondon ni Dr. Dahlo, Dr. Jill Jim, Dr. Va, Koje access what an he kid des in on hijo, but they okay dot hadaino no. So we just wanted to in our segment here again. We're in Washington D.C. At the NIHB quarterly meeting, and we'll be here for the Tribal Nation Summit at the White House or sponsored by the White House. And, up-to-date information coming out from Washington, D.C. through Dr. Webb and others. We appreciate your service, Dr. Webb, and thank you for joining us during our town hall every Tuesdays, at least while I'm in office, every Tuesdays at 10 a.m. to give you the updated information to take care of yourselves and to make better choices for your families as well. So thank you so much, everyone, for tuning in. We have Dr. Jill Jim, Navajo Department of Health. We also have Del Yazzie, our epidemiologist, on standby, and we also have Dr. Va, the Indian Health Services. So thank you so much. Take care of yourself. Remember, we know what to do. follow the same things that have kept us safe these past 3 years to push back on COVID-19. That's a monster, modern day monsters. Guess what, ladies and gentlemen? We have the armor. The armors is the mask and the vaccine to fight this modern day monster that has snuck into our homes and our communities and our nation. God bless you. Take care of yourself. And I'll turn the time over to Dr. Jill Jim. Dr. Jim.
Oh, yeah, President, good morning to you on the East Coast, and thank you for always having these town hall meetings and attending the National Indian Health Board meeting. The National Indian Health Board is a organization that advocates with leaders on health issues, and so I'm just thankful that he's continuing to work with the National Indian Health Board. And Dr. Cameron Webb, thank you for joining our town hall meeting as well. It's very important to get the latest news from the national perspective. So a head to you, Dr. Webb, for joining us as well. And then for for the weekly update, as a reminder, I know Dell's going to go over the EPI report, and from my perspective, I wanted just to reassure to everyone to just monitor your symptoms and any signs that you might have regarding COVID. We know that RSV, the regular cold, and the flu are around as well. So just being careful out there when you're gathering, and also, as President mentioned, staying home, and then wearing your mask in public. I know a mask requirement is not a requirement outside the Navajo Nation, but I'm always thankful to see a lot of our relatives out there wearing their masks still while grocery shopping. Of course, eating, you can't really avoid that. I know that people do take precautions and taking out to-go orders still. And those are still things that are happening here on the Navajo Nation. As I mentioned before in the town hall last week, the public health orders have lifted many of the restrictions as far as gathering limits. And so we just expect everyone to follow the COVID-19 safe practices guidelines to ensure that people do gather safely, and to avoid such as avoiding crowded areas, ensuring there's proper ventilation. Washing your hand and sanitizing are still important, not only for COVID, but also for the other respiratory viruses that I mentioned. So I wanted just to kind of reiterate what President said and others on this call. And vaccinations is very important. And I know Dr. Val will talk about that. We are now monitoring the new vaccine, the up-to-date definition for the bivalent booster dose. And we want to make sure everyone gets their booster dose. And studies do show that the bivalent booster dose does support making sure that you're less likely to get the Omicron variant. And there are new strains around, and I think Dell and Dr. Vaughn can talk about that through our surveillance efforts for the COVID-19 as well. So things are changing again here, not only on the Navajo Nation and across the United States, and we're probably seeing different subvariants of Omicron as well. So also hostito non Adenik etcheshe kwa oda the hasiondo ado ashkene ka aba the honosen tati nisha stoti kwa din hichiton hizet obik es hioteno sin hitkanes ke go onle on da ke go do aho wanda da all tradition all chuna bichinto bezebik eba askit. So I just wanted to make that one clear message again, and then hand it over to Dell and then as well as Dr. Bob. I just want to thank all of you as always for joining us here at Diasonostangi. So Dell, oh no, Dr. Bob, why don't you take it away with an update from the Indian Health Service? I know you're a valuable member of our Health Command Operations Center, and Dr. Gaines and Captain Johnson are not able to join us today, but thank you for joining us and providing a report from IHS. Take it away, Dr. Bob.
Thank you so much, Dr. Jim. And thank you, everybody. And I want to echo all the positive messaging as President Nez has mentioned, and Dr. Webb, as well as Dr. Jim, on behalf of IHS, it's always a pleasure to be able to have this camaraderie with our Navajo Nation partners. And as a physician, I love serving the Navajo communities. With that being said, some updates, and I know Dell is going to dive into this a bit more as well. Um, and so from our IHS facilities, and of course, we work closely with our Navajo Nation partners as well as Navajo Epicenter and Navajo Department of Health, is where are we right now? In regards to COVID-19, our COVID activity, we do see it high, although it's likely plateauing. It's just high activity. Very similarly, we are also seeing cases of RSV and influenza. This is not abnormal. We're seeing the trends that we're seeing across the United States as well as regionally. We are seeing RSV activity going up and high here in Arizona, as well as going high in New Mexico. And then we also see, high influenza activity in the Southwest region. And so what we're feeling regionally is also what we're seeing locally as well. With that being said, one of the things is that hospitalizations have been low and our hospital systems have not been under stress, which is a good thing. It means that we are able to continue to provide primary care and care to those that need it most, whether it's due to these respiratory viruses such as COVID, RSV, or flu, or due to other things. And so that's good. We don't see the strain and stress on our hospital systems. I also want to take this time to talk a little bit about these other viruses, right? So it's not all COVID. It is also RSV and flu. What is RSV? And so Dr. Jim mentioned RSV, and it's really RSV typically presents like the cold. And what it stands for is respiratory syncytial virus. The population at highest risk that we really want to protect, of course, is yes, the high risk elderly, but really the small babies as well. So, unlike COVID and influenza, RSV doesn't have a vaccine yet available. So some of the precautions that we still recommend with COVID will also be recommended with influenza and RSV. What does that mean? It means, masking up will help. It also means sanitizing surfaces will help. And then, of course, avoiding large gatherings. And so specific to RSV, we want to make sure our tiniest folks in our community are protected. And so during this RSV season, which typically lasts, a few months, if you have anybody in your family that's an infant, a newborn, you want to limit their exposure to crowds and limit their exposure to anybody who has cold-like symptoms. And of course, you want to keep all the babies up to date with their vaccines. You want to make sure if they're having any cold-like symptoms and it's getting worse and you're seeing that they're fatigued or tired or not eating as much, go ahead and check in with your local provider to make sure that they're doing okay. And so just to reiterate that, things that protect against RSV will be masking, avoiding large gatherings, but also for those littlest ones, as we think about the holidays, if anyone in the family is sick or have cold-like symptoms, keep those babies, home safe. Encourage your family members to stay home if they're feeling cold-like symptoms as well. And what you don't want to do is hand the babies around. And that's one of our ways to protect our littlest ones during this respiratory season. With the flu, there is a flu vaccine and it continues to work. The reason likely why we see such low COVID hospitalizations and flu hospitalizations is because folks are getting vaccinated. For COVID, Dell will go over the numbers, but as Dell goes over them is that we have a high percentage of our population that has completed the primary series. I believe it's close to 70%, if not higher. And we also have a higher than national numbers of our folks that have completed the bivalent booster. What's the bivalent booster? It is the newest booster for this season. And so, about 14 to 16% of our population here in Navajo Nation have gotten their bivalent booster. We want that even higher for our older folks who are at high risk for severe illness. And so the messaging is the same. You know, those vaccines, they work. They're keeping our hospitalizations low, despite the high number of cases. And so for this year, this season, mask up, stay home when sick, protect those little babies, as well as protect our elderly folks, which everyone already is doing, and then get vaccinated for the viruses that you can get vaccinated for. That is the flu, get your seasonal flu vaccine, and also complete your primary series and get that bivalent booster vaccine if you haven't gotten it already. And from our end, you know, as IHS, we will continue to work with Navajo Nation. We continue to work with our facilities across the nation here as well to continue to advocate and promote health across our communities. Thank you very much. And I'm going to introduce Del, who will give the more detailed update for both COVID as well as vaccine numbers. Thank you all.
Okay, thanks, Dr. Val. Thanks, everyone. Hi, I'm Del. I'm with the XUC COVID epidemiology team. As mentioned, we've been tracking COVID disease on the Navajo Nation for almost 3 years now. So this is our latest update for Navajo Nation COVID-19 Nashni Nalka. As you all know, we've transitioned to weekly updates now instead of daily updates. So as of we crafted this report yesterday. So it covers, well, this slide is recent cases, weekly cases and trends. It's going back about 8 to 9 weeks or 60 days. So going back to about all the way to September 21st, the week of September 21st to last week, Thanksgiving week. So we did see an increase since September, the week of September 21st. As you see, the bars are higher than the week of September 21st. However, we are the last 2 weeks here on the far right. We're still seeing a high number of cases, but we're remaining somewhat stable, even though high numbers. We're on this little plateau for now. Some core metrics here that we measure over our 7-day case rate is now at 278 cases per 100,000 people. That is still, as I mentioned, high for us. And then percent staff beds occupied by COVID patients is at 7.3%, which is at medium risk. And then the hospital admission rate per 100,000 people is at 0.65 admissions per 100,000 people, and that remains at medium risk. Some additional metrics here. There were 441 new cases over a 7-day period, which is a plus 13% change from the previous week. And then our 7-day lab-based test positivity continues to fall, now at 19%. Previous week was at 22%, so good sign that it's decreasing. And then hospital capacity for bed occupancy for regular hospital beds is at 66%. And then ICU bed is at 71%. So they're both below our 80% threshold. So that's again a good sign. And then Dr. Va just mentioned the vaccine coverage for Navajo Nation residents. I understand she has updated numbers, but I'll go over the numbers from the previous week. We are at about 70% have completed the primary series. And then about a little over 14% are up to date with the new bivalent booster definition. And then we continue to surveil the COVID strains on the nation. Up to now, we've pretty much detected all of the Omicron sublineages. I'll go over that more in detail here in a little bit. This is pending update, but I'll just go over it real quickly here. Vaccination status among Navajo Nation residents only. There are 131,406 Navajo Nation residents who have completed the primary series. And then almost at 27,000 are up to date. So 14% are up to date with the latest definition, and 70% have completed the primary series. Epidemic curves here for both the Navajo Nation in blue and then the US in red. So on the far right here, we continue to vary or fluctuate from week to week. So the blue line is Navajo Nation, and then the red is the US COVID epi curve. This is our 7-day case rate. Comparing Navajo Nation, we continue to be first. This yellow line up here is Navajo Nation over a 7-day period. Case rates. One thing really to highlight here is, as you notice, the red bars are all the four corner states within our bordering states are all in the top 10 with the highest 7-day case rates compared to the other 50 states. So a lot of COVID burden, a lot of COVID cases occurring within our region. So that's something really to take note of. As you can see here, 7-day case rate per 100,000 within our region, the four corner states, especially Arizona and New Mexico, with the really two of the three highest 7-day case rates across the country. And then community transmission, all of the counties really in our region are all red, meaning high COVID transmission. And then this is our COVID strain surveillance. This is hopefully will get updated later this week. So this is report 69 from November 7th. It's about 3 weeks ago. So the only highlight here is the BA5 and sublineages, which includes the BF.7 and the BQ.1, are now the predominant variants detected on the nation. It went from the previous report at 510 to 538. So we'll see what the latest update is, hopefully later this week. This is the CDC variant profile according to CDC across the country. Really now, as of November 26th, last Saturday, the two Omicron, the BA5 sublineages here, the BQ.1.1 and the BQ.1 are the two predominant Omicron sublineages across the country. So they are almost at 30% each, causing COVID across the country. So we'll continue to monitor this as well with our own Navajo Nation COVID strain surveillance. And last, this is our COVID-19 high transmission chapter list. So on the far left here, the green column, 47 chapters made the list. The previous week was 45, so it did increase by 2 chapters. And then if you go across to the right here, going back in time, going back to 6 weeks over here on the far right, the red column here, at least 6 weeks ago. And since then, these 24 chapters have been on this list every week for about 6 weeks now. So this is my last slide. So I'm going to stop here. Let me see. Stop sharing my screen. Let me see who's still on the call. I think my mom, Dr. Fowler, is not on the call. I think I am the last presenter. Unless Dr. Va, you want anything to add? If not, I'm the last presenter. So thank you all for joining us. And we'll see you again next week. Thanks so much. Have a good day. Bye.